Tonight, in medical rounds, heart disease is the leading cause of death in this country, and the American Heart Association is working with top doctors to reduce deaths from cardiovascular disease and stroke. And joining us live now from Hartford Hospital is Dr. Waseem Chaudhry. He is a preventative cardiologist at the Hartford Healthcare Tallwood Men's Health Center. And we thank you so much for being with us tonight, Dr. Chaudhry.
Thank you.
Well, first, the question I have for you is how common is heart disease and what are the key risk factors for heart disease? Let's review that.
Sure. Yes. So heart disease is a #1 cause of death worldwide, and nearly half of U.S. adults suffer some type of heart disease. And there's really 7 attributable risk factors that can cause heart disease, like stroke and heart attack. Stuff such as hypertension, diabetes, being overweight, obesity, high cholesterol, and lack of activity, exercise, and all those things. Yep.
Well, listening to that, in my head, I'm ticking off, yep, you can control that, you can control that, you can control that. So how do you, as a preventative cardiologist, this must be your work at the Tallwood Men's Health Center, how do you help men identify and then lower the risk factors that they can change and control?
Yes, so you're absolutely right. Actually, studies show that 80% of heart disease is actually preventable. And at Men's Health, we really focus on men in a way that besides just checking and treating those 7 risk factors, we also do blood work for checking for genetic predisposition for heart disease. We can actually look objectively, non-invasively at the heart arteries to look for any kind of atherosclerosis going on, the process of blockage formation, and treat that accordingly.
So there's a lot you can do to prevent a heart attack by these various screening techniques. And, you know, we hear about women dying of heart disease, but I do know that men die of heart disease, more of them than women do. And why is that?
Yes, you're right. There's actually 1 out of 4 men die of heart disease each year in the U.S. And heart disease is about 40% more common in men than women. It has to do with their genetic makeup and also how they spend their lives and things like that, their habits as well, the lifestyle. And really, like, all those things really matter.
Yes, they do. They all add up, don't they? We thank you so much, Dr. Chaudhry, for some great information for all men out there, and certainly for the women who care for them as well. Thanks again, and good luck with your event that you have planned on heart disease.